Why transform preoperative assessment into a perioperative care service? Perioperative medicine is patient-centred multidisciplinary care delivered from the moment surgery is contemplated through to full recovery. But that's not what many of us are currently delivering. At our trust, preoperative assessment is frequently too late in the pathway, repetitive and inefficient. We work in a large multi-site trust performing around 30,000 operations a year. We know that around 1 in 7 surgical patients is high risk, and that proportion is rising. So we undertake a huge volume of surgery, caring for increasingly complex patients, yet we don't consistently support them in the best way. The Centre for Perioperative Care is clear that POA alone is not enough. High-risk patients need structured risk assessment, shared decision-making, prehabilitation, post-surgical care. Preoperative assessment is an important part of that journey, but it is only one slice of the cake. And why does this matter? Because evidence in the literature is growing. Perioperative care delivers clinical benefit, reduced costs, and happy patients. A triad that CPOC coins the holy grail of healthcare. Before designing solutions, we need to understand the problem. Using recognised QI methodology, we mapped our system and its barriers. This gave us the rather intimidating fishbone diagram in the top right, which we've summarised into this more user-friendly version with 6 key themes. Together, they reveal the anatomy of our perioperative pathway problem. For example, there is no agreed standard for what constitutes a good referral into pre-op assessment. Appointments are often scheduled days before or even after a patient's surgery date. Our teams are spread across multiple sites, limiting collaborative decision-making. Our system does not reliably deliver evidence-based optimization for chronic disease, and there is no single view of a patient's journey. For patients, this is little more than a lottery. We turned our barriers into drivers for change. Our driver diagram, consolidated here, generated over 40 change ideas. This has evolved into a programme of perioperative transformation across the trust, supported through a multidisciplinary clinical reference group. As part of this, we have redesigned the elective surgical pathway. Patients receive a digital questionnaire as soon as they are booked for surgery and are then risk stratified into streams, guiding how they are assessed and who assesses them. For patients identified as medium or high risk, this generates a personalised preparation plan, connecting them to targeted optimisation. While this story comes from one trust, we suspect our challenges will feel familiar to many hospitals. Here we have shared how we are making change and becoming part of the future of perioperative care in the UK.